one correct options, right? Hey everyone, today we'll be discussing a few MCQs from dental histology, and these are the MCQs that I have got for you. And today just remember that there won't be just a single correct option. There might be a single correct option, or there might be more than one correct option. So go through the questions uh, patiently and look at each option and see if just one option is correct or more options are correct. Good evening, Tanvi. So let's start with this first question. Which of the following factors influences the permeability of enamel? Now you have often got a question on the permeability of dentine, right? You have often got a question on the permeability of dentine, but here I am asking you about the permeability of enamel. So which of these options do you think affect the permeability of enamel? Is there just a single correct answer, or do you think there are more than one options that can affect the permeability of enamel? So let's go to these options one by one, right? So presence of the prism boundaries. So what it means is, let's say the enamel prism is what, keyhole shaped, right? The enamel prism is almost a keyhole shaped, isn't it? And we say that this entire is made up of hydroxyapatite, and then the boundary is made up of organic component, isn't it? The organic component. So this prism boundary is organic, right? This prism boundary is organic. So the prism boundary, right, whether it is dense or rare, right, whether they are defects or whether it is perfect, that would also decide the permeability. So option A is correct. Let's go to the next option. Thickness of the enamel layer. Now thickness of the enamel layer in general does not affect its permeability, right? It's just you have one layer, then you have another layer. There may be it may be several millimeters thick, or it may be worn out to maybe less than 0.5 mm thick. So it won't affect the permeability of enamel as such. Option C is degree of mineralization. So higher the degree of mineralization, lesser will be the pore volume. So what is pore volume? As we just talked about this prism boundary, right? So let's say these are several prisms. Now I'm just making them or drawing them as circles, but they are keyhole shaped, right? Just for the ease, I'm drawing them as circles, right? Let's say these are prisms, right? These are several prisms, or you can say enamel rods. So initially, when the tooth erupts, there are several imperfections between these enamel rods, isn't it? And these imperfections are known as pores, and they have a total volume of approximately 5% in a newly erupted tooth. So a newly erupted enamel is porous, but as the person ages, as the tooth ages, this pore volume reduces and the tooth becomes less and less permeable. So it becomes more and more impermeable. So even option C is correct. So option C also affects the permeability. Bhavna, as I have said, there may be a single correct option, or there may be more than one correct option. So you need to go through each and every option carefully, right? Option D, presence of enamel spindles. Now enamel spindles is just the extension of Tome's fiber, that is the odontoblastic process from the dentine into enamel. It won't affect the permeability of enamel since it does not reach the surface of enamel. So again option D does not affect the permeability. Option E, age related changes in enamel. So as we just discussed the age related changes, that is mineralization, isn't it? The enamel becomes more and more mature, it becomes more and more impervious with age. So both, all these three options, that is A, C and E, will affect the permeability of enamel. So in this particular question, you will have three correct answers, A, C and E. Is it clear? So let's go to the next option, next question. Arrange the following stages of enamel formation in the correct order. So this is the another pattern of MCQ. Let's not call it an MCQ. These are not strictly MCQs, right? So let's arrange the following stages of enamel formation in the correct order. So basically these questions are to test your understanding of the subject, right? कितना समझा है आप लोगों ने वो टेस्ट करने के लिए. So these are not strictly MCQs. So the different stages of the formation of enamel that we have to arrange, right? So these are enamel mineralization, secretion of the enamel matrix proteins, then maturation of enamel and ameloblast differentiation. So which of the four do you think is the foremost stage? Which of these four will occur first? So enamel mineralization, secretion of enamel matrix proteins, maturation and ameloblast differentiation. So obviously whenever any hard tissue or any secretion has to take place, the secretory tissue or the secretory cell has to mature first. It has to differentiate first, isn't it? So unless the cell or the tissue is differentiated, it won't secrete anything. So first step would be ameloblast differentiation, right? First step would be ameloblast differentiation. That is option 4, and Bhavna is saying that it is 4, 1, 2, 3. Sorry, B बोला है भावना ने. 4, 2, 1, 3. So exactly, once the ameloblast is differentiated, then protein, that is the organic matrix of enamel, will be formed. After that, this organic matrix will calcify. That is, it will undergo mineralization, and once it is mineralized, later in the maturation stage, it will mature, right? That is, the 30% mineralized enamel will convert into 96% mineralized enamel, isn't it? So that is maturation. So initially there is mineralization and then there is maturation of the enamel. So the correct sequence would be 4, 2, 1, 3, right? So next question. How do Hunter-Schrager bands contribute to the enamel's ability to resist fracture? You know what Hunter-Schrager's bands are, right? Let's say this is the DEJ, this is the surface of the enamel. So as we move from DEJ to surface, the orientation of enamel rods is wavy, it's zigzag. But in the outermost 1/5, it's all parallel, isn't it? It's all parallel. So what happens in the inner 4/5? In the inner 4/5, what happens is, some enamel rods, when you take a section, they would be sectioned transversely, right? They would be sectioned transversely. Some would be sectioned longitudinally. Again, some would be sectioned transversely, and then some would be sectioned longitudinally. So because of these changing orientation of enamel rods, a particular pattern is created, right? Alternating dark and light zones are created. These alternating light and dark zones are called Hunter-Schrager band. ये अपन ने क्लास में पढ़ा है, right? Hunter-Schrager band क्यों बनते हैं? Because of the different orientation of enamel rods, and they are seen in polarized light or reflected light. तो polarized light में भी दिख सकते हैं, reflected light में भी दिख सकते हैं, right? So what are the options? By increasing porosity, which allows stress absorption. So there is just a change in the orientation of enamel rods. It won't increase the porosity. By alternating prism orientation, which distributes stress across the enamel. So yes, this appears a correct option. Let's go to the third option. By forming a dense uniform structure without weak points. Again, this is wrong, because there is just a change in the orientation. Number of rods, they will remain the same. The density of the rods remains same, right? It won't change. By acting as organic reinforcement, again, these are inorganic structure, right? Enamel rod है, inorganic है. So organic reinforcement जैसा कुछ भी नहीं है. So option would be by alternating prism orientation which distributes stress across the enamel. That is also a point. You can also say that since if you look at it in a broader perspective, what would you see is that they form a crisscrossing pattern. The enamel rods in different levels, right? Let's say in a superficial level, they are all oriented like this, but in a level below it, they may be oriented somewhat like this, right? So when you take a look at these Hunter-Scheger bands in a broader perspective, what you would see is that they are oriented in a crisscrossing pattern. So whenever a stress or a mechanical force is applied to the surface, there might be formation of a crack, but this crack won't travel to much depth into the enamel because of this crisscrossing pattern. So it acts as a stress breaker. कैसे एक्ट करता है ये? स्ट्रेस ब्रेकर की तरह एक्ट करता है. It acts as a stress breaker, right? समझ में आ रहा है आपको? So let's go to the next question. Which feature of dentinal tubules affects dentine permeability, especially with advancing age? ठीक है. So this is the question pertaining to dentine. Again, we are talking about the permeability, just like the first question where we were talking about the enamel permeability. Now we are asking about the dentine permeability, especially with regards to the advancing age. So option A is presence of odontoblastic process within the tubules. So presence of odontoblastic process within tubules in respect to advancing age has nothing to do with the permeability of dentine. Decreased tubule diameter near the enamel dentine junction. So we know that at the DEJ, the dentinal tubule has a lesser diameter, isn't it? At the pulp, the diameter is approximately 2.4 microns or 2.5 microns, whereas at the DEJ, it is approximately 1 micron. So yes, the diameter of the dentinal tubule decreases. But do we have a better option? Yes, this can be included as a answer, but we can have a better option, isn't it? Option C, the tapering nature of tubules from the pulp towards the outer dentine. So yes, it also has a tapering nature. You can classify it as a tapering. Shape. But then it does not say whether it is converging or diverging. So this is partially correct, right? Now let's go to the option D, occlusion of dentinal tubules by peritubular dentine. So जो option D है, it is happening because of the option B is happening because of the option D. The narrowing or the decrease in the tubular diameter at the DEJ is because of the peritubular dentine deposition, and that is why option D is better as compared to the option D. Option B and D दोनों सही है, but which is better? It is the option D. और since यहाँ पर ये नहीं लिखा हुआ है कि select multiple options or something like that, we will select only single option. तो कभी कभी ऐसे ऑप्शन क्वेश्चंस भी आएंगे जहां पर वन और मोर ऑप्शंस विल अपीयर करेक्ट, बट यू हैव टू सिलेक्ट जस्ट वन ऑप्शन, इजंट इट? तो वहां पर आप ये पूछोगे कि ये हो रहा है, if an option is given and you think that this option is correct, but if there is another option which explains that option, the previous option, then you will go for that basic option. ठीक है ना? जैसे कि यहाँ पर है ऑप्शन B is telling you that there is a narrowing at DEJ, but then option D explains why there is narrowing, what is getting deposited, so it is a better option. Clear? तो यहाँ पर क्या होता है कि peritubular dentine deposition है, and this peritubular dentine deposition causes the narrowing of the dentinal tubule. So that is why option D is a better option. Next question, examine the image below showing a longitudinal section of dentinal tubules. So these are all dentinal tubules, right? These are all dentinal tubules. What can be inferred about the direction and significance of these curvatures? So what is the significance of these curvatures, this S-shaped curvature? इसकी significance क्या है? Option A, these curvatures help increase dentine's permeability to external stimuli. So do you think the curvature will increase the permeability, or do you think it will decrease the permeability? Because any fluid will not have a direct access from here to the pulp, isn't it? There is no direct access. the fluid will have to go through a curved tubule, isn't it? It will have to go through a curved tubule. So its motion, its movement will be hindered. So permeability would actually be decreased because of this S-shaped curvature. So option A is incorrect. Option B, they provide the dentine with structural flexibility and resistance to fracture. So because of this S-shaped curvature, there is an inherent flexibility. There is an inherent flexibility to the dentine. और ये हमने पढ़ा भी है पहले. Dentin is a viscoelastic material. Why is it viscoelastic? Because of the presence of collagens, right? And dentinal tubules. So option B को हम रख लेते हैं. It may be correct. Option C, the curvature are indicative of carious lesions. This is wrong. Option D, they represent a defect in dentine. Again, this is wrong. These are not defect. These are the natural structure of the dentine, isn't it? So option B is the correct answer. What is the approximate composition of dentine by weight? So this we have studied in class. You can take it as a sort of a revision, isn't it? So what is the approximate composition of dentine by weight? It is 70% inorganic, 20% organic and 10% water. Similarly, अगर आपसे enamel का पूछें, what is the composition of enamel? Enamel is also quite simple, isn't it? 96% inorganic, approximately 3% water, and approximately 1% is organic, isn't it? So that is the composition of enamel by weight. Which of the following defense cells are commonly found in dental pulp and contribute to its immune response? तो यहाँ पर हमारे पास क्या, select all that apply, which means that there are more than one correct options. तो यहाँ पर क्या लगता है आपको, कौन कौन से डिफेंस सेल्स हमें पल्प के अंदर मिलेंगे? Macrophages are present, isn't it? Macrophages are present. T lymphocytes are present. The B lymphocytes are absent. These are absent in pulp, isn't it? B lymphocytes are absent in pulp, but T lymphocytes are present. So cellular immunity तो है, but humoral immunity absent है, right? Humoral immunity is absent, but the cellular immunity is present, and the dendritic cells, they are also present. So do you think the plasma cells are present? Do you think the plasma cells are present or not? The plasma cells are absent, isn't it? The plasma cells are absent in pulp. A, B and D, right अंशुल? A, B भी है और D भी है. Dendritic cells, ठीक है? Antigen presenting cells, very good. Match each cell type in the dental pulp with its function. तो यहाँ पर हमारे पास कुछ एक cells हैं. Very good भावना and अंशुल, बिल्कुल सही है आपका, है ना? तो यहाँ पर हमारे पास कुछ cells हैं, odontoblasts, macrophages, fibroblasts and dendritic cells, and then we have their functions. So take a look at these cells and tell me if you can match them with their functions. So पहले सबसे पहले अपन odontoblast ले लेते हैं, right? Odontoblast. So which of the following A, B, C and D do you think is the function of odontoblast? तो बहुत ही simple है, ऐसा कोई बहुत मुश्किल नहीं है, सिर्फ रिवीजन के लिए एक तरीके से, है ना? ये रिवीजन के लिए है कि भाई हमें पता चले कि हमने कितना पढ़ा है, उसमें से हमें कितना याद है. तो ओडोंटोब्लास्ट का क्या है फंक्शन? एंगेजेस इन एंटीजन प्रेजेंटेशन एंड इम्यून रिस्पांस, नहीं. सिंथेसाइजेस कोलेजन कंपोनेंट ऑफ एक्स्ट्रासेल्युलर मैट्रिक्स, नो. फॉर्म्स एंड मेंटेन्स डेंटिन मैट्रिक्स, इजंट इट? तो ये क्या हो गया? ओडोंटोब्लास्ट का फंक्शन. नेक्स्ट इज मैक्रोफेज. मैक्रोफेज का फंक्शन क्या होगा? मैक्रोफेज इज अ फैगोसाइटिक सेल, इजंट इट? मैक्रोफेज इज अ फैगोसाइटिक सेल. भावना ए का 4, डेंड्राइटिक सेल एंगेजर एंटीजन प्रेजेंटेशन, वेरी गुड. ए का 4, वेरी गुड, ठीक है. मैक्रोफेजेस का क्या होगा? फैगोसाइटोसिस, तो ये 2. और फाइब्रोब्लास्ट ऑब्वियसली इट विल सिंथेसाइज कोलेजन एंड अदर एक्स्ट्रा सेल्यूलर मैट्रिक्स, इजंट इट? ऑप्शन 3, राइट. तो मेरे ख्याल से आई सीईटी में शायद मैच द फॉलोइंग टाइप क्वेश्चंस आते हैं कभी कभी, है ना? यहां पर आपको सब समझ में आ रहा है? कुछ पूछना है? नाउ आई थिंक यू कैन सॉल्व दिस क्वेश्चन ऑन योर ओन. अभी तक मैंने बहुत सारी हेल्प की है ना, थोड़ा सा आप लोग सॉल्व करो. भावना है, अंशुल है, और एक और शुरू में बच्ची थी तन्वी. राइट, ऑल ऑफ यू maybe you can try and solve this question. Which of the following are the main functions of cementum? Very good, Bhavna. B3C1, very good. So which of the following are the main functions of cementum? Now again you have select all that apply, which means you will have more than one correct options, right? So let's examine the first option. To anchor the tooth to the alveolar bone via the periodontal ligament. Do you think this is correct or wrong? अगर गलत लगे तो मुझे बताना, सही लगे तो भी बताना, ठीक है? ऑप्शन बी, टू कंट्रीब्यूट टू द कलर ऑफ द टूथ क्राउन. दैट मीन्स सीमेंटम affects or contributes to the color of the tooth, specifically the crown. Option C. Yes, Bhavna, they are very easy. Questions are often easy when you understand them, when you read them, and these same questions become difficult when we are in a hurry. जब एग्जाम में बैठे होते हैं ये क्वेश्चन मुश्किल हो जाते हैं, जल्दीबाजी होती है और भी कई सारी चीजें चल रही होती है ना. तो लेट्स गो थ्रू दीज questions, है ना. Let's go through these options and see which of these are correct. A, B, C or D. Whether all are correct or a few are correct. To allow for continuous attachment of PDL throughout life. And option D says to resist orthodontic force by remodeling like bone. So they say that the option D is saying that it remodels just like bone, and hence it is helpful during orthodontic treatment by resisting the force. So Bhavna is saying that B is wrong. Chalo theek hai, B is wrong, obviously, because cementum is present on the root, not on the crown, right? So it does not contribute to the color of the crown. Rarely it would be present on the crown, right? Rarely, when there is a degeneration of the reduced enamel epithelium before the tooth erupts into the oral cavity, isn't it? तो वो तो पैथोलॉजिक स्टेट हो गई है. वी आर नॉट कंसर्न अबाउट द पैथोलॉजिक स्टेट, वी आर कंसर्न अबाउट द फिजियोलॉजिक स्टेट. तो फिजियोलॉजिकली ऑप्शन बी तो गलत हो गया, ठीक है. एंड भावना सेज ऑप्शन ए इज करेक्ट. सो अग्रीड, ए इज करेक्ट. इट एंकर्स, दैट इज द प्राइमरी फंक्शन, isn't it? The primary function of the cementum, it forms a part of the periodontium. It anchors the tooth to the bone. Option C is correct. Very good. It allows for continuous attachment of PDL throughout life. Yes. Secondary cementum or the cellular cementum keeps on depositing throughout the life, and the role of the cellular mixed fiber cementum is to provide attachment, is to provide adaptation, isn't it? So once there is a resorption or once there is a loss of the attachment, again cementum will get deposited, isn't it? Initially क्या होता है, root है, root पे there is acellular cementum, and with this acellular cementum there is attachment of the PDL. But once there is an eruption of the tooth, and loss of the attachment, let's say there is a loss of the attachment in the apical region because of the eruption of the supra eruption of the tooth, then what will happen? Then extra layer of cementum will be deposited, isn't it? Cellular cementum will be deposited, cellular mixed fiber cementum, and again you will have the PDL attachment, isn't it? Yes, option D is also wrong, because cementum does not remodel like bone, isn't it? It does not remodel like bone, and the forces are mainly resisted by PDL. ठीक है, तो एक तो रीमॉडलिंग नहीं होती है और दूसरा रेजिस्टेंस जो है वो PDL से मिलता है, ना कि सीमेंटम से. वेरी गुड. सो नेक्स्ट क्वेश्चन. A 45-year-old patient, this is a case-based question, isn't it? A 45-year-old patient presents with tooth mobility following PDL disease. Radiographs show area of cementum resorption along with the root surface. So there is a resorption in the root surface as well as cementum, right? There is a resorption in cementum and the root surface. What is the most likely histological finding in the area of resorption? So in the area of resorption, what will you find? Let me read the options to you and then you can tell me the answer, right? So options are cementocytes within lacunae. It says that you will find cementocytes in the resorption lacunae. Option B, Sharpie fibers embedded in cementum. So Sharpie's fibers will be seen within the cementum in the site of resorption. Option C says reversal line indicating repair. You will see a reversal line. And option D says that you will see an incremental line of Salter. So which of these four do you think we will see histologically in this resorption bay? Anshul says incremental lines of Salter. Actually, incremental lines of Salter are the incremental lines of cementum. Let's say this is the cementum and it gets deposited incrementally, just like dentine and enamel, right? So between subsequent increments, you will see the incremental lines of Salter. But then the problem is there is a resorption, isn't it? So when there is a resorption, don't you think these incremental lines of Salter and everything else would be resorbed? And since this resorption extends to the entire depth of the cementum and extending into the dentine, there won't be any incremental line seen, isn't it? The incremental line would not be seen. B is one choice or multiple. Beta, as you can see, there is no choose multiple or something like that. So obviously what I feel is that there should be just a one correct answer here, isn't it? Now Bhavna says B, Sharpie's fiber embedded in cementum. Sharpie's fibers कहाँ से आते हैं? ये बाहर bone है, right? This is the bone, and the Sharpie's fibers, they extend from bone into the cementum, isn't it? And as I have just explained that there is a loss of the entire layer of cementum, ठीक है, entire layer of cementum. So do you think there would be any Sharpie's fiber? Sharpie's fiber दिखेंगे क्या जब cementum ही नहीं है? What is Sharpie's fiber? The portion of PDL embedded either in bone or in cementum. So when there is no cementum, do you think there would be Sharpie's fiber embedded in cementum? वो कहीं से दिखेंगे क्या? नहीं दिखेंगे ना? This is the cementum. This is the PDL, and outside here is the bone. Now when the cementum itself has resorbed, do you think any fiber embedded in cementum would be seen? No, isn't it? भावना फिर से B कह रही है. भावना फिर से B क्यों कह रहे हो? जब सीमेंटम ही नहीं है तो सीमेंटम के अंदर का फाइबर वो कैसे दिखेगा? ये सीमेंटम है. This is the cementum, and any fiber embedded within the cementum is Sharpie's fiber, but there is no cementum. So where does the Sharpie's fiber embedded in cementum come from? It won't be seen, isn't it? ऐसा कुछ है ही नहीं ना. जब cementum ही नहीं है तो cementum के अंदर का फाइबर भी resolve हो गया, isn't it? So option B is also incorrect. So option A is incorrect, option B is incorrect, and as Anshul के साथ हमने discuss किया, option D is also incorrect, isn't it? Incremental lines of Salter. So what will happen? Just like the bone, what happens is when there is a resorption, let's say this is the tissue, let's say this is the dentine, and overlying the dentine is the cementum, right? And then there was this PDL. तो जब रिजॉर्प्शन हुआ तब क्या हुआ? When there was resorption, this entire cementum was resorbed, isn't it? Cementum was resorbed, and so was the dentine. But then there must have been an attempt at repairing, right? There had been an attempt at, okay, अरे वही ना, लैग की वजह से गड़बड़ हो रही है, मेरा बहुत स्लो चल रहा है ये. अब सही हुआ, ठीक है. तो लैग तो क्या होगा? देयर वुड बी एन अटेम्प्ट एट रिपेयरिंग. सो रिपेयर की वजह से क्या होगा, वी विल सी दोज रिवर्सल लाइंस, isn't it? The reversal lines, these would be the junction where the resorption has ended and redeposition or deposition of or the repair of the heart tissue has restarted, right? So reversal line हमें देखने को मिली, just like the bone. Is it clear? Next question, again we have a match the following type, match the two groups. Match each type of cementum with its most appropriate description. ठीक है? So we have different types of cementum here: acellular extrinsic fiber, cellular intrinsic fiber, afibrillar cementum, and hyaline layer of Hopewell Smith. So I think I have taught all of these different types of cementum in class, so you can easily answer. Let's go with the first option, that is acellular extrinsic fiber cementum. So which of these four do you think is a description for acellular extrinsic fiber? Which of these four is a description for acellular extrinsic fiber? Thin layer located between dentine and acellular cementum. तो ये तो वैसे ही नहीं होगा, acellular cementum option में ही आ गया है ना. Option B contains cementocytes. Again it says contains cementocytes, and here the first word itself is acellular, isn't it? Contains no cells or fibers and forms in area of the cemento-enamel junction. Option D provides attachment by Sharpie's fiber to the periodontal ligament. So which of these do you think correctly describes the acellular extrinsic fiber cementum? Is it option A, B, C or D? कौन सा होगा इनमें से? Now Anshul, you actually were a bit hasty in choosing between option C and D. Just take a look at the option D, and I'm sure you would feel that option D is a better choice than option C. Why? Because it has no cells and it has no fibers, but acellular extrinsic fiber, isn't it? Extrinsic fiber definitely has fibers, isn't it? It definitely has fibers. So it can't be a cementum which does not have fiber. And here, as you can see, provides attachment by Sharpie fiber to the PDL. So Sharpie's fibers, ठीक है ना, ये वो cementum है जिसमें Sharpie's fibers embedded होते हैं. So Sharpie's fibers are embedded only in extrinsic fiber cementum or mixed fiber cementum, isn't it? तो मिक्स्ड फाइबर सीमेंटम ऑप्शन में ही नहीं है. दैट इज वाई Sharpie's फाइबर्स का मतलब क्या हुआ? एक्सट्रिंसिक फाइबर सीमेंटम, दैट इज एसेल्युलर एक्सट्रिंसिक फाइबर सीमेंटम. और योर ऑप्शन 1, ऑप्शन सी, दैट इज एसेल्युलर एफिब्रिलर सीमेंटम, isn't it? It is acellular afibrillar cementum, that is option 3. बस ऐसे ही आसान क्वेश्चन जो है वो मुश्किल हो जाते हैं, बिकॉज समटाइम्स वी टेक अ लुक एट जस्ट 1 or 2 ऑप्शंस एंड वी से दैट yes, it is very easy, and we hastily mark the question, isn't it, without reading all the options correctly or properly. तो तब वो क्वेश्चन मुश्किल हो जाता है, right? Read each and every option carefully. So which of these is the cellular intrinsic fiber cementum? Now we have discussed already option C and D. So option C and D तो हो गए, isn't it? Option C और option D तो हो गए. So which of these remaining two describes cellular intrinsic fiber cementum? Is it option A or option B? Thin layer located between dentine and acellular cementum, or it contains cementocytes and helps in adapting to tooth movement. So this is the cellular intrinsic fiber cementum. Cellular intrinsic fiber cementum or cellular cementum keeps on depositing throughout the life, isn't it? Once the root formation is complete, any cementum that forms thereon is the cellular cementum, be it intrinsic or mixed, but cellular cementum will form. So cellular cementum means it has cementocytes, isn't it? Cellular cementum का मतलब क्या हुआ? Cementocytes हैं. तो ऑप्शन ए और बी में cementocytes किसमें है? It's in the option B, isn't it? So option B किसका हो गया? सेकेंड. वेरी गुड। तो ऑटोमेटिकली ऑप्शन ए किसका हो गया? 4, दैट इज हाइलीन लेयर ऑफ होपल स्मिथ। ये हमने क्लास में भी पढ़ा था। द आउटर मोस्ट लेयर ऑफ द रूट सरफेस is the hyaline layer of Hopel Smith. So hyaline layer of Hopel Smith, on its outer side you will outer side you will see the acellular extrinsic fiber cementum, and on the inner side you will see the regular dentine, right? Since this hyaline layer, it's a hybrid layer, isn't it? We neither classify it as cementum nor we classify it as dentine. So अंदर dentine है, बाहर cementum है, right? Option A is the hyaline layer of Hopel Smith. Is it clear? So now we have a picture based question. Examine the image showing a cross section of the oral mucosa. तो ये भी बता दिया आपको कि ये cross section है oral mucosa का. Identify the layer labeled B which lies between the epithelium and the underlying structure. तो ये तो ऊपर हो गई epithelium और बाकी नीचे बहुत कुछ है. But what we need to identify is this layer that is labeled B. Right? So options are keratinized layer, lamina propria, submucosa and stratum spinosum. तो क्या आंसर होगा इसका? What is the keratinized layer? Basically these are the different types of epithelium, keratinized or non-keratinized. Here I hope you can appreciate this keratin layer. I hope you can appreciate the keratin layer, right? And hence this entire epithelium is keratinized, isn't it? Now what is submucosa? Submucosa is all the tissue that lies beneath the connective tissue. So the tissue that lies beneath the connective tissue is the submucosa. Stratum spinosum क्या है? Stratum spinosum is one of the layers of the epithelium, isn't it? Stratum basal, then spinosum, then granulosum, then corneum, isn't it? So stratum spinosum is a layer of the epithelium. And what is lamina propria? So lamina propria is nothing but the connective tissue, isn't it? It is nothing but the connective tissue. अंशुल हिस्टो डिफिकल्ट नहीं है, आराम से पढ़ोगे अपने आप पता चल जाएगा. एंड इफ एट ऑल यू हैव एनी डाउट, डोंट हेजिटेट टू आस्क. ठीक है ना? हिचकिचाओ मत पूछने में, बेहिचक पूछ डालो बस कि क्या है क्या नहीं है, जो भी कुछ है. अगर आपको कहीं भी कोई डाउट लग रहा है यू कैन आस्क. ठीक है? जब तक पूछोगे नहीं तब तक समझ नहीं आएगा, राइट? सो यू नीड टू आस्क whatever the doubts you have, you need to ask them, right? और बाकी धीरे धीरे हम जैसे थोड़ा थोड़ा करके समझेंगे तो हिस्टो भी आसान हो जाएगी. जैसे यहाँ पर है, तो यहाँ पर भी अगर हम देखें, जैसे हाउ कैन वी क्लासिफाई दिस एपिथेलियम, वेदर इट इज keratinized or non-keratinized, and if it is keratinized, whether it is orthokeratinized or parakeratinized. So what you need to do is you need to take a look at this superficial layer, right? The outermost layer. तो यहाँ देखो, क्या ये continuous layer की तरह दिख रही है या नहीं दिख रही है? It appears like a continuous layer, isn't it? It appears like a continuous layer that lacks nucleus, isn't it? There is no nucleus, and it appears like a continuous layer, isn't it? And since it appears like a continuous layer, इसका मतलब क्या हुआ? Keratin है. And since there are no nucleus, it means this is a orthokeratinized layer. Had there been nuclei in this layer, तो हम क्या कहते हैं? Parakeratinized layer है. And if we could have made out individual cellular boundaries, right? Individual plasma membranes हमें दिख जाती है हर एक सेल की. That means there was no keratin, so it would have been non-keratinized, right? भावना क्या कह रहे हो? सबम्यूकोसा इज जस्ट बिलो एपिथेलियम इन कनेक्टिव टिश्यू. बेटा देयर इज नो एपिथेलियम इन कनेक्टिव टिश्यू. ये एपिथेलियम है, ये कनेक्टिव टिश्यू है और ये सबम्यूकोसा है, राइट? दिस इज दी एपिथेलियम. beneath the epithelium is the connective tissue. Beneath the connective tissue is the submucosa, right? So inside the submucosa you will see all the glands. ठीक है? salivary gland or the sebaceous glands, they are all located within the submucosa, isn't it? All the appendages, तो अगर हम स्किन की बात करें तो अपेंडेजेस जो भी हैं, तो स्किन की जब हम बात करते हैं, व्हाट इज स्किन? स्किन इज एपिथेलियम प्लस कनेक्टिव टिश्यू. व्हाट इज ओरल म्यूकोजा? ओरल म्यूकोजा इज एपिथेलियम प्लस कनेक्टिव टिश्यू. तो क्वेश्चन मार्क मुझे नहीं पता तुमने क्यों बनाया है, बट मे बी यू आर कंफ्यूज बिटवीन द म्यूकोजा एंड एपिथेलियम, right? It is not the epithelium that combines the overlying cellular structure and the underlying connective tissue. No, it is the mucosa in oral cavity and skin, right? Outside the oral cavity. तो बाहर तो क्या है, ये skin है, isn't it? So skin is epithelium plus connective tissue. Similarly, in the oral cavity, it is the mucosa. Oral mucosa बोलते हैं, है ना? ऐसे थोड़ी ना बोलते हैं oral epithelium. अपन क्या बोलते हैं? oral mucosa. So that mucosa consists of epithelium and the connective tissue. So epithelium is the overlying cellular structure and connective tissue is the underlying connective tissue. और क्या सही है कि नहीं बात? तो connective tissue में क्या होता है? blood vessels हैं, nerves हैं, collagen fiber है, and all those things are there. The appendages, right? So if we are talking about skin, then sweat gland, hair follicle, sebaceous glands, they are all located in submucosa. Yes, submucosa you can say, right? ओरल कैविटी में हेयर फॉलिकल्स भी है ना, केवल सेबेशियस ग्लैंड्स और सलाइवरी ग्लैंड्स हैं. देयर आर नो स्वेट ग्लैंड्स. क्लियर? इज इट क्लियर अंशुल? अच्छा, वन मोर थिंग, व्हेनेवर यू आर स्टडीइंग हिस्टोलॉजी, ट्राई टू स्टडी इट विद अ डायग्राम, राइट? जो भी तुम पढ़ रहे हो कोशिश करो उससे एक डायग्राम सामने रखा हो. और कोई सी भी बुक ले सकते हो, टेंकेट, ऑबिन्स, बर्कोविट्स, कोई सी भी किताब हो, उसमें अगर हिस्टोलॉजी का डायग्राम सामने है, वहां नहीं मिल रहा नेट पे देख लो, ठीक है ना? तो अगर डायग्राम सामने होगा पढ़ने में आसानी होगी, समझने में आसानी होगी, राइट? सो कीप अ प्रॉपर्ली लेबल्ड डायग्राम इन फ्रंट ऑफ यू, सो दैट वुड हेल्प यू, इजंट इट? A patient report increased sensitivity of food, increased sensitivity to food, temperatures and textures. Histological examination of the oral mucosa reveals an abundance of nerve endings beneath the surface. Which layer of oral mucosa is most likely responsible for transmitting this sensation? तो क्वेश्चन क्या है? सिंपल है. कभी कभी हमें इंग्लिश में नहीं समझ में आता, इतना लंबा चौड़ा हो गया, राइट? So let's translate it into Hindi or maybe the other language that you are comfortable with. Whichever language you are comfortable with, you can translate it in that language. तो जैसे मैंने इतना सारा इंग्लिश पढ़ा, हो सकता है मुझे नहीं समझ में आया, ठीक है? जैसे लास्ट में आते मैंने सेंसेशन को कुछ और वर्ड पढ़ लिया, किसी वर्ड को कुछ और पढ़ लिया. I might make mistakes, right? So what is the best way to simplify this question? It is to translate it in the language that I best understand, right? तो मैंने क्या कहा, एक पेशेंट आया हमारे पास, उसको सेंसिटिविटी हो रही थी खाने से, टेम्परेचर से, ठीक है, और उसके टेक्सचर से भी. तो टच एंड टेम्परेचर दोनों से ही उसे दिक्कत हो रही थी. अब हमने हिस्टोलॉजिकली देखा तो हमें क्या दिखेगा? कहाँ पर? ओरल म्यूकोजा में बहुत सारी नर्व्स दिख रही हैं सरफेस के नीचे. और विच लेयर ऑफ ओरल म्यूकोजा? अब ओरल म्यूकोजा की कौन सी लेयर की वजह से ये सब प्रॉब्लम हो रही होगी? अब ओरल म्यूकोजा की कौन कौन सी लेयर्स होती हैं बताओ? Which different layers do you know of oral mucosa? What are the different layers of oral mucosa? What are the different layers of oral mucosa? Connective tissue and epithelium, isn't it? There are just two layers. There are just two layers, epithelium and connective tissue, isn't it? देखा? Question is very simple, but options are difficult. Answer is difficult actually. ऐसा ही होता है ना? क्वेश्चन समझ लिया तो अंशुल कभी भी डी नहीं कहता. कहता क्या? क्योंकि क्वेश्चन क्या कह रहा है? सी व्हाट इज द क्वेश्चन आस्किंग? व्हाट इज द क्वेश्चन आस्किंग? द क्वेश्चन इज आस्किंग विच लेयर ऑफ ओरल म्यूकोजा, इजंट इट? बाकी सब भूल जाओ, सिर्फ ओरल म्यूकोजा वर्ड को भी पकड़ोगे तो भी सब म्यूकोजा और ओरल म्यूकोजा सेम हो गया क्या? सब म्यूकोजा मीन्स समथिंग बीनीथ द ओरल म्यूकोजा. विल इट बी अ पार्ट ऑफ ओरल म्यूकोजा? टेल मी. मतलब सिंपल अपन इंग्लिश की बात करते हैं, हम तो कहते हैं हमको नहीं आती डेंटिस्ट्री, चलो छोड़ दो उसको, पर हमने एक वर्ड लिया ओरल म्यूकोजा, दूसरा वर्ड लिया सब म्यूकोजा. सब का मतलब बीनीथ, म्यूकोजा मतलब म्यूकोजा, तो बीनीथ म्यूकोजा, दिस इज समथिंग दैट इज बीनीथ म्यूकोजा, isn't it? So it can't be a part of oral mucosa. सही कहा ना मैंने? तो द क्वेश्चन इज नेवर डिफिकल्ट, इट इज हाउ वी इंटरप्रेट इट दैट मेक्स इट आइदर डिफिकल्ट और इजी। ठीक है ना? तो ये सारे क्वेश्चन आसान ही लाया हूं मैं तुम्हारे लिए, पर तुम्हारा इंटरप्रिटेशन इनको डिफिकल्ट या इजी बनाएगा, राइट? तो ओरल म्यूकोजा की लेयर्स तो दो ही है, एपिथेलियम और कनेक्टिव टिश्यू। और अभी हमने प्रीवियस क्वेश्चन में डिस्कस किया, अंशुल ने अभी आंसर भी कर दिया, ऑप्शन सी लैमिना प्रोप्रिया, isn't it? So let's go to the next question. Place the following layers of keratinized oral mucosa in correct order starting from the deepest layer. तो नीचे तो क्या हो गया, ये कनेक्टिव टिश्यू है, दिस इज द कनेक्टिव टिश्यू। फिर इसके ऊपर कौन सी लेयर है, दिस शुड बी द फर्स्ट वन, एंड देन विच लेयर डू यू हैव, दैट शुड बी द सेकेंड वन। Moving to the outermost layer. So from the innermost we have to move to the outermost layer, right? So which is the innermost layer? Is it the spinosum, basal, corneum or granulosum? Which is the innermost layer? It has to be सबसे नीचे यानी बेस में, है ना? So has to be basal, and here it becomes quite easy for you, isn't it? Just one option with option 2 at the beginning, right? So basal followed by spinosum followed by granulosum and corneum is the outermost layer. तो ये हमने पीछे भी कहीं ना कहीं डिस्कस किया ही है, right? So let's go to the next question. Which of the following structures are integral component of TMJ? तो TMJ का integral component कौन कौन है? Now here we have select all that apply. तो इसका मतलब क्या हुआ, सिंगल ऑप्शन या मल्टीपल ऑप्शंस करेक्ट होंगे? मल्टीपल करेक्ट ऑप्शंस होंगे यहाँ पर, है ना? मल्टीपल करेक्ट ऑप्शंस होंगे। तो फर्स्ट ऑप्शन क्या है, मैंडिबुलर फॉसा, ऑप्शन बी इज लैटरल टेरिगॉइड मसल, ऑप्शन सी इज टैलोमैंडिबुलर लिगामेंट एंड ऑप्शन डी इज इंट्रा आर्टिकुलर डिस्क। तो थिंक अबाउट दीज ऑप्शंस केयरफुली एंड टेल मी which of these options are correct, A, B, C and D. So which of these options are correct? Option A is mandibular fossa. Very good, mandibular fossa is an integral part, ठीक है ना? mandibular fossa what else? This is the disc, isn't it? Components like it associated, right? I don't know what it means. You decide what it means. Integral component of TMJ, मुझे तो ये वर्ड लिखना था, लिख दिया। ये एक्सप्लोर डिटेल लिखनी थी, लिख दी। अब इसका क्या मतलब हो सकता है वो तुम सोचो, ठीक है ना? इनमें से कौन कौन सी चीजें हैं जिन सबको मिलाकर के हम कहेंगे कि ये पूरा का पूरा TMJ है, ठीक है? और क्या हो सकता है यहाँ पर, और यहाँ पर क्या होता है, फाइब्रो कार्टिलेज, isn't it? फाइब्रो कार्टिलेज होता है, और क्या होता है, A, B and D. Intra-articular disc has to be intra-articular disc ना, inter-articular disc। अरे TMJ is a single joint, isn't it? TMJ is not two joints. यहाँ पर ये double joint नहीं count करते. It is upper and lower part of a single joint. And since it is a single joint, it will be intra-articular disc, not inter-articular disc. समझ गए? इंट्रा वर्ड क्यों यूज हो रहा है? क्योंकि ये पूरा का पूरा दिस इज वन जॉइंट, ठीक है ना, दिस इज अ सिंगल जॉइंट, दिस इज अ सिंगल जॉइंट, दिस इज नॉट टू जॉइंट्स, राइट। इस आर्टिकुलर डिस्क के ऊपर अपर हाफ है और इसके नीचे लोअर हाफ है, राइट, एंड कंबाइंड इट इज अ सिंगल जॉइंट। क्लियर है? इट इज अ कॉम्प्लेक्स जॉइंट, क्योंकि यहाँ पर तीन कंपोनेंट्स है जॉइंट के अंदर। यूजुअली सिंपल जॉइंट्स कैसे होते हैं, उनमें दो ही कंपोनेंट्स होते हैं, दो ही आर्टिकुलर सर्फेसेस होती हैं। यहाँ पर दो से ज्यादा आर्टिकुलर सर्फेसेस हैं, दैट इज व्हाई इट इज अ कंपाउंड जॉइंट और अ कॉम्प्लेक्स जॉइंट। क्लियर है? तो इंटर आर्टिकुलर डिस्क की कहलाएगी, इंटर नहीं कहलाएगी। ऑप्शन ए, बी एंड डी, वेरी गुड अंशुल, दे आर द करेक्ट आंसर्स हियर। Next question, which ligament primarily restricts excessive posterior movement of the mandible in TMJ? तो excessive posterior कौन करेगा? जो इस जॉइंट को सब तरफ से ढक करके रखेगा, राइट। सो बेसिकली इट इज द कैप्सूल, बट स्पेसिफिकली अगर हम बात करें, then what happens is that the anterolateral part of the capsule, the anterolateral part of the capsule thickens to form the lateral ligament, isn't it? The anterolateral part of the capsule thickens to form the lateral ligament, and this lateral ligament is specifically involved in restricting the retrusive or the excessive posterior movement of the mandible. Is it clear? So let's go to the next question. The image below shows a histological section of a salivary gland. What type of SNI is represented in the area marked by the arrow? तो अभी एरो मार्क दिख रहा है आपको एक, तो यहाँ पर हमें पता करना है कि ये कौन सी एसिनाई है। नाउ देयर आर ओनली टू टाइप्स ऑफ एसिनाई, isn't it? One is serous and the other one is mucus, isn't it? And then there is a mixed, where some cells are serous and some cells are mixed, some cells are mucus, isn't it? But overall हम क्या कहेंगे कि it is either serous or mucus. क्लियर है? तो मिक्स तो हम यूजुअली कंसीडर नहीं करते हैं, मिक्स यूजुअली ग्लैंड्स को कहते हैं, वेयर सम एसिनाइज में बी सीरस, सम एसिनाइज में बी म्यूकस, सम म्यूकस एसिनाइज विल हैव सीरस डेमिल्यून ऑन देम, राइट। तो यहाँ पर तो हमें ये बात करना है कि जो हमें ये एरो मार्क किया गया, बेसिकली इट इज अ सेल, isn't it? You can see the outline of the cell. This is the cell, isn't it? यहाँ पर भी ये दूसरा सेल, then this is the third cell, right? This is the fourth cell, and so on, right? और जूम करूं? Here, I think it's clearly visible now, right? देखो, कॉलमनर तो सीरस म्यूसिनस दोनों ही कॉलमनर दिखेंगे, ठीक है। इट इज नॉट अबाउट हाउ द शेप ऑफ द सेल्स अपीयर, इट इज अबाउट द कंपोनेंट्स ऑफ द सेल। Look at the nucleus. First of all, the nucleus is round, isn't it? The nucleus is round, whereas in the mucinous it is flattened, isn't it? Then you can clearly see these globules here, isn't it? You can see these spherical structures here, these spherical organelles, isn't it? And haven't I told you about zymogen granules? the secretory granules that are seen at the apex of the cell, isn't it? They are containing the proteinaceous component of the saliva, isn't it? तो यहाँ सब जगह हमें क्या दिख रहा है? zymogen granules, isn't it? So zymogen granule alone is sufficient to identify this cell as serous cell. Is it clear? तो यहाँ देखो सब जगह दिख रहे हैं ना ये zymogen granules, ये zymogen granules, फिर ये देखो राउंड न्यूक्लियस, isn't it? बाकी कुछ जगह हमें न्यूक्लियस दिख भी नहीं रहा, isn't it? We can't see the nucleus at certain places, and yet we can see these zymogen granules, right? So these zymogen granules, the presence of these zymogen granules alone is sufficient to classify this acini as serous acini and these cells as serous cells. Is it clear? तो अगर ये म्यूसिनस होता तो भी बेटा पिरामिडल ही होता सेल. Even then the cell would have been pyramidal, isn't it? It's just that the nucleus would have been flattened, right? And most of the cytoplasm would be filled with mucin. Most of the cytoplasm would be filled with mucin, which would have led the cell to expand, isn't it? So cell थोड़ा expanded सा दिखेगा, nucleus compressed दिखेगा. That's why it will appear flattened, isn't it? And the entire cytoplasm appears to be filled with mucin. अब थोड़ा छोटा कर सकते हैं ना, जूम आउट कर सकते हैं ताकि अपन देख पाए. राइट, तो आगे बढ़ते हैं. नेक्स्ट क्वेश्चन. What is the primary function of myoepithelial cell in the salivary gland? तो myoepithelial cell का क्या मेन फंक्शन हो गया? Secretory होगा क्या? Is it secretory or does it assist in expulsion of saliva? Does it assist in expulsion of saliva or does it assist in secretion of saliva? So option A क्या है? Produces mucus secretion. So it does not produce anything. It is not a secretory cell, isn't it? Myoepithelial cell का मतलब क्या हुआ? Myoepithelial. So it means it is an epithelial cell. It is an epithelial cell, but with a muscle-like property. Muscle-like property, isn't it? So that means it's a contractile epithelial cell. Simple सी बात है, नाम से पता चल रहा है ना. तो इसमें ऑप्शन क्या हो गया? Produces mucus secretion. नहीं. Modify the ionic composition of saliva, that is done by the striated ducts, isn't it? Option C facilitates secretion by contracting around acini. तो जैसा कि अंशुल और भावना ने बोल ही दिया है, option C is the correct answer. So let's go to the next question. Arrange the following steps in the correct order during salivary secretion. ठीक है, तो फिर से एक match the following नहीं, sorry, arrange these steps in their correct order, right? So options are myoepithelial cell contraction, secretion of saliva into acinar lumen, modification of saliva in striated duct, and transport of saliva to the collecting duct. तो सबसे पहले तो क्या होगा? Which of these will occur before rest of these steps? Which step is the first one to occur amongst these? So first of all, saliva will be produced, isn't it? Saliva production, or you can say saliva secretion. So where is the saliva secretion? It is the second option, है ना, option 2. So when the saliva is secreted, it is still within the acini. So when it is in the acini, then myoepithelial cell will contract, isn't it? Myoepithelial cell will contract, and when the myoepithelial cell contracts, it will expel the saliva into intercalated duct, and from intercalated duct into striated duct. Once it reaches the striated duct, then what will happen? Then the modification of saliva will take place, isn't it? Sodium and chloride will be reabsorbed and potassium and bicarbonate will be secreted into the saliva, isn't it? So potassium और bicarbonate secrete हो गए, तो modification हो गया saliva का. And once saliva is modified within the striated duct, then it will move into the collecting ducts, from where it will move into the excretory duct. So collecting ducts basically are part of the excretory duct itself, right? So correct sequence क्या होगी? 2 1 3 4. That is option A. पता नहीं ये सब बच्चे सी 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 क्या कर रहे हैं. Is it for question number 18 or 19, Anshul and Bhavna? क्वेश्चन 19 के लिए तो क्या होगा? ऑप्शन ए, isn't it? सबसे पहले सलाइवा सीक्रेशन, then expulsion, then modification, and then its transport into oral cavity, right? So myoepithelial cell, does it exert its effect only on the acini, or does it also contract? Does it also exert its effect on the intercalated duct? Does it also exert its effect on the intercalated duct? So myoepithelial cell, it contracts the acini and it also compresses the intercalated duct, right? So myoepithelial cell are seen associated with both acini and the intercalated duct. Next question. Which embryonic structure contributes to the formation of dental papilla during tooth development? So simple, dental papilla is derived from what? So dental papilla is derived from neural crest cells, right? It is derived from neural crest cells. Yes, Anshul. It is associated with both intercalated duct and acini. So next question की हम बात कर रहे थे. Which embryonic structure contributes to the formation of dental papilla? So dental papilla किससे बनता है? It is formed from the neural crest cells, right? And the next question is, which tooth match each tooth developmental stage with its key characteristic? Tooth development stage with the key characteristics. So bud, cap and bell stage हैं. और characteristics क्या है? Enamel and dentine matrix formation begins. So hard tissue formation हो गया ना ये, तो hard tissue. So hard tissue formation तो कब होगा? In the bell stage, isn't it? Hard tissue formation कहाँ होता है? Bell stage के अंदर, isn't it? Proliferation of the epithelial cells to form the tooth bud. Proliferation of epithelial cell forms the tooth bud. So basically this is the characteristic of bud stage, where the proliferation of epithelial cells takes place and it takes the shape of a bud. So remaining अपने आप ही क्या हो गया? Cap, isn't it? Is it clear, everyone? So let's go to the next question. Yes, Bhavna. First का B, second C, and third is A, right? So let's go to the next question. Which of the following structures develop from the dental papilla during the tooth development? So again we have a select all that apply. So there may be one or more options correct, right? So dental papilla से क्या क्या structures बनते हैं? Options are enamel, dentine, pulp and PDL. So which of these do you think develop from dental papilla? Which of these do you think develop from dental papilla? Is it enamel, is it dentine, is it pulp or is it PDL? इनमें से कौन सा है जो कि dental papilla से बनेगा? Enamel is an ectodermal tissue, isn't it? Rest these three are derived from ectomesenchyme. Dentine, pulp and PDL are all derived from ectomesenchyme, isn't it? Or you can say neural crystals. So which of these is derived from dental papilla? Is it BCD or is it BC? Is it CD or something else? Yes, very good. Dentine and pulp are derived from dental papilla. PDL is derived from dental sac, isn't it? From dental sac. PDL is derived from dental sac, right? Dentine and pulp are derived from papilla. Clear? The image shows a tooth at the stage of active eruption. This is a histological diagram, isn't it? And it shows a tooth at the stage of active eruption. Which structure facilitates the degradation of the soft tissue to enable tooth emergence? तो ये ऊपर ये तो है दांत, दिख रहा है तुम्हें स्ट्रक्चर? लेट मी हाईलाइट इट फॉर यू. ये देखो, ये रहा. This is the tooth, isn't it? And this is the, here is the overlying epithelium, isn't it? So they are asking which structure facilitates the degradation of overlying epithelium for the emergence of the tooth. तो टूथ ओरल कैविटी में एमर्ज हो जाए उसके लिए कौन सा स्ट्रक्चर है जो कि इस ओवरलाइंग म्यूकोजा को डिसॉल्व करने में हेल्प करेगा? सो ऑप्शंस आर ए बी डी एंड डी. ए बी डी एंड डी. सी तो नहीं है, चलो सी तो ठीक है, कहीं नीचे है, तो एनीवेज वी हैव रूल्ड इट आउट, राइट? एंड बेसिकली इफ यू टेक अ लुक एट दिस सी, इट इज नथिंग बट दी बोन. ये तो बोन है, ठीक है? ए बी डी और ई. So which of these four do you think helps in the eruption? Which of these four do you think helps in the eruption or penetration to the oral mucosa? Very good, Bhavna. ठीक है? So what is E? What is E? E is nothing but the reduced enamel epithelium. What is D? D is the oral mucosa. So we have to penetrate through the oral mucosa. In the question we are talking about dissolving this oral mucosa. So oral mucosa itself can't be the answer, isn't it? Then B, what is B? B is nothing but the pulp. Again, pulp would be wrong, isn't it? And then what is A? A क्या है? A is the enamel space. So this is the space formed by the loss of enamel. आपने decalcified section लिया है ना, ये decalcify जैसे अपन ने किया, enamel all of it will be lost because 96% of enamel is mineral, isn't it? So reduced enamel epithelium helps in the eruption of or the emergence of tooth as it dissolves the overlying connective tissue and oral epithelium. So oral mucosa को dissolve करती है ये. So what does REE secrete to dissolve the oral mucosa? It secretes three factors. What are those three factors? TGF beta 1, macrophage colony stimulating factor 1, that is MCSF1, and third is PTHRP, ठीक है, parathyroid hormone related protein. So these are the three factors that are secreted by the reduced enamel epithelium or the dental follicle that will help in dissolution or the absorption of the overlying oral mucosa. Is it clear? तो आज का लास्ट क्वेश्चन है ये. Which of the following factors are involved in the eruption of tooth? So again it is related to the question that we have just seen. How to identify tooth? Will it appear like here? As tooth तो tooth है बेटा, everywhere it will appear like it appears here. This basic outline of the tooth will be seen if it is a tooth, isn't it? If it is a tooth, the basic outline will remain the same. तो मोलर है तो ऐसा ही दिखेगा, प्रीमोलर है तो भी ऐसा ही दिखेगा, इंसाइजर या कनाइन है तो it might appear a little bit different, but the basic structure of the tooth will remain the same, isn't it? You can identify the dentine, pulp. Again this is the floor, right? then you can easily identify the enamel space, then you can identify the overlying epithelium, there is bone, isn't it? So these certain features are constant any tooth you take, right? Yes, white means there is space. Had there been any tissue, it would have been stained, isn't it? H&E staining जब हम करते हैं, कोई सा भी tissue हो, it will stain. If there is a white space, it means that is a space. There is no tissue present in that area, isn't it? Empty है वो. तो यहाँ पर इस white को भी कंसीडर करो, थोड़ा दूर से जाकर के देखोगे तो आपको दिखेगा ना, दांत है, enamel वाली स्पेस है, वो white क्या enamel है, isn't it? Enamel is lost, right? Since this is a demineralized section, this is not a ground section. ठीक है, समझ में आ रहा है? तो ये जो बेसिक कंपोनेंट्स है ये हर जगह सेम ही रहेंगे, ये चेंज नहीं होंगे. टूथ भी होगा, पल्प भी होगा, इनामल स्पेस भी होगा, नीचे बोन भी होगी, ऊपर अगर एमरजेंस से पहले है तो ऊपर एपिथेलियम भी होगी. एंड इफ इट इज अ erupted tooth, then obviously you will not see an overlying reduced enamel epithelium, right? ये overlying tissue हमें नहीं दिखेगा. So which of the following factors are involved in the eruption of teeth? दांत के eruption में कौन कौन से factors हमें help करते हैं? And again we have multiple options that can be correct. Option A is bone resorption, growth of the root, eruption force from the dental follicle, and resorption of deciduous teeth. So which of these factors do you think are applicable or are helpful or are the driving factors which help in the emergence or eruption of tooth? A, B, C and D. इसमें से तुम लोग थोड़ा आइडेंटिफाई करने की कोशिश करो. Bone resorption, do you think it will be helpful in eruption? Do you think it will be helpful in eruption? Bone resorption? Yes, isn't it? Growth of the tooth root. Do you think the growth of the root helps in eruption? And the answer is no, isn't it? Root formation is a result of eruption. Root formation is a result of eruption, not otherwise, right? Again, option C, eruption force from the dental follicle. We have just seen that dental follicle secretes some factors which help in eruption of the tooth. It lyses the overlying connective tissue and the epithelium. So yes, option C is also correct. Option D, that is resorption of deciduous teeth. Again, this is correct because it facilitates in the easy eruption of the permanent or the succedaneous tooth, isn't it? So we have three correct options here, that is A, C and D. So apart from option B, all the options are correct. So option A, C और D ये सभी करेक्ट हैं. भावना सी में क्या दिक्कत है? सी तो हमने अभी अभी पढ़ा है कि इट हेल्प्स इन इमरजेंसी, इजंट इट? ये देखो यहाँ पर REE, इज दिस स्ट्रक्चर नॉट आल्सो नोन एज डेंटल फॉलिकल? तो हम REE कहें या डेंटल फॉलिकल कहें, बात तो एक ही है, इजंट इट? तो सेम चीज हम यहाँ पर बोल रहे हैं कि डेंटल फॉलिकल हेल्प्स इन द इरप्शन, isn't it? So C also helps in eruption, right? A, C and D, all these three help in eruption of the tooth. तो ये हमारा हो गया है आज की क्लास. अगर कुछ पूछना है तो आप लोग पूछ सकते हैं. Is there anything that you would like to ask? कोई चीज जो नहीं समझ में आई हो, कुछ और पूछना हो? तो ठीक है, फिर कल मिलते हैं हम लोग. राइट। डीएम का पूछ लो, बट अलग से पूछ लो। अभी डीएच का इस टेस्ट का कुछ पूछना है तो पूछ लो। क्या पूछना है डीएम का वैसे तुम्हें? क्या पूछना है भावना? रॉट एंड कास्ट मेटल में डिफरेंस ब्रीफली। बहुत सिंपल है ये तो। हम्म। See, whenever you cast a metal the first time, very first time, ठीक है, you have what you have done is, let's say you had a metal block, you had a block of metal, ठीक है ना, तुम्हारे पास एक मेटल का ब्लॉक था, ठीक है, तुमने क्या किया, तुमने इसे मेल्ट किया, राइट, एंड आफ्टर मेल्टिंग यू कास्टेड इट इन अ फॉर्म ऑफ अ सिलेंडर, राइट। तो इसको तो हम क्या कहेंगे, कास्ट कहेंगे कि रॉट कहेंगे? वी आर रिपीटेडली यूजिंग अ सिंगल वर्ड, राइट, कास्ट 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 कास्ट। Yeah, we'll discuss everything, rigidity and etc etc etc, and maybe you will tell me everything. तो जैसे जैसे मैं करता हूँ वैसे वैसे तुम बोलते जाओ, बस उतना उतना बोलते जाओ, ठीक है। तो अभी हमने क्या किया, मेल्ट किया, मेल्ट करने के बाद हमने उसे क्या किया, वी poured it in a particular shape, and let's say that shape is cylindrical, this cylindrical, isn't it? So this is which metal, cast or rod? We have casted it, so we will call it cast metal, ठीक है। Now what happens is that we can't use, being dentists, we can't use a cylinder of steel, isn't it? To use it, it must be in the wire form. It must be in the form of a wire. We can't use a solid cylinder, isn't it? Even if it is as thick as this pen, we can't use it. We need it thin, isn't it? Maybe 0.5 mm or 0.7 mm or 0.9 mm, but we need a wire, isn't it? So to make it in the form of a wire, what we need to do is we need to strain it. स्ट्रेन करना पड़ेगा ना इसको, हम इस पे स्ट्रेस लगाएंगे तो ये स्ट्रेन होगा, चेंज होगा, इसकी 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 शेप चेंज करनी पड़ेगी। तो व्हाट वी डू इज वी पास इट थ्रू सक्सेसिवली स्मॉलर डाइज। तो जब हम इसे सक्सेसिवली स्मॉलर डाइज के थ्रू पास करते हैं तो क्या होगा, ये जो सिलेंडर है, इतना सा सिलेंडर, इट विल कन्वर्ट इट इन दी फॉर्म ऑफ अ वायर, अ वेरी लॉन्ग वायर, इजंट इट? तो ये तो क्या हो गया, वायर, ठीक है। And to convert this cylinder in the form of a wire, what we did is we strained it. So after the application of stress, it is strained and it converts in the shape of a wire. This is known as wrought metal. समझ में आ रहा है? एक तो था कास्ट मेटल, जब हमने मोल्टन मेटल को पोर किया किसी की शेप में, दैट इज कास्ट। उसको जब आपने स्ट्रेस लगाया और आपने उसे इलोंगेट कर दिया, शॉर्ट कर दिया, कुछ भी कर दिया, आपने उसकी शेप चेंज कर दी कुल मिला करके, तो दैट इज द रॉट मेटल, इजंट इट? Now tell me, what change do you observe here as far as the molecular structure is concerned, as far as its grain structure is concerned? इसका जो ग्रेन है उसका क्या हुआ होगा? क्या इसका ग्रेन भी एकदम स्ट्रेस्ड होगा या नहीं होगा? इसका ग्रेन में एकदम बहुत ज्यादा स्ट्रेस लग रहा होगा ना। यहाँ पर तो इसका ग्रेन कैसा है, यहाँ पर इसका ग्रेन कैसा है, स्ट्रेस फ्री, एट रेस्ट। लेकिन यहाँ पर इसका ग्रेन कैसा है, स्ट्रेस्ड। क्लियर है? आपने स्ट्रेन हार्डनिंग नाम की चीज तो पढ़ी ही होगी, क्योंकि हम ब्रीफ में बात कर रहे हैं अभी, तो बहुत ज्यादा मैं तुम्हें शायद ना बता पाऊं, बट स्टिल आपने स्ट्रेन हार्डनिंग तो पढ़ा ही होगा। एंड वी हैव एक्सेसिवली स्ट्रेन्ड इट, सो डू यू थिंक इट्स स्ट्रेंथ विल इंक्रीज और डू यू थिंक इट विल डिक्रीज? हमने यहाँ स्ट्रेन कर दिया कि नहीं कर दिया इसको, ये स्ट्रेन्ड है ना, राइट, इट इज स्ट्रेन्ड। सो स्ट्रेन हार्डनिंग हैज टेकन प्लेस, सो स्ट्रेंथ का तो क्या हुआ, स्ट्रेंथ तो इंक्रीज हो गई, इजंट इट? व्हाट हैपेंड टू द ब्रिटलनेस? ब्रिटलनेस बढ़ी कि घट गई? ये ज्यादा डक्टाइल है कि ज्यादा मैलिएबल, ज्यादा डक्टाइल है कि ज्यादा ब्रिटल है? दिस वायर दिस वायर इन कंपैरिजन टू दिस कास्ट, इज इट ब्रिटल और इज इट डक्टाइल? हमने बहुत ज्यादा स्ट्रेन हार्डनिंग कर दी है, ये हार्ड हो गया है, ठीक है। क्या हो गया ये? हार्ड। तो ये ब्रिटल हो गया या डक्टाइल हो गया? ब्रिटल हो गया या डक्टाइल हो गया? अगर नहीं समझ में आ रहा तो इस तरीके से भी देख सकते हो, देखो बहुत आसान तरीका है। ये स्ट्रेस स्ट्रेन कर्व है, ठीक है। स्ट्रेस स्ट्रेन कर्व के ऊपर कोई भी मटेरियल हो, इसी तरीके से उसका कर्व बनता है, इजंट इट। इनिशियली क्या होता है? इलास्टिक स्ट्रेन, इलास्टिक के बाद प्लास्टिक रीजन, और फिर उसके बाद अल्टीमेट स्ट्रेस जहां पर वो फेल हो जाता है, यही होता है ना। तो लेट्स से यू हैव स्ट्रेस दिस मटीरियल बियॉन्ड द इलास्टिक लिमिट इनटू द प्लास्टिक लिमिट। तो आपने बहुत ही ज्यादा एक्सट्रीम स्ट्रेन कर रखा है, तो मे बी इस पॉइंट तक आपने इसको स्ट्रेन कर दिया है। कर दिया कि नहीं कर दिया? तो इसके बाद अब मुझे बताओ, एक तो आपके पास ये वायर है जो कि ऑलरेडी इस पॉइंट बी पर है, और एक आपके पास ये इनगॉट था जो कि इस पॉइंट ए पर था। तो विच ऑफ दीज टू इज ब्रिटल? ऑब्वियसली इट इज द रॉट मेटल विच इज ब्रिटल, ठीक है ना। तो रॉट मेटल तो है ब्रिटल, कास्ट मेटल है डक्टाइल। और क्योंकि आपने इसको सीवियरली स्ट्रेन किया है, दैट इज वाई दिस रॉट वायर when it is first formed is excessively brittle, and that is why we need to do a stress relieving heat treatment, जिसे annealing कहते हैं, है ना। annealing भी तुमने सुना होगा, annealing सुना है ना। तो annealing करनी पड़ती है जब भी आप किसी कास्ट मेटल को कन्वर्ट करते हो रॉट मेटल में। जब आप पहली बार ऑर्थोडोंटिक वायर बनाते हो या आप एंडोडोंटिक फाइल बनाते हो, कुछ भी बनाते हो, फ्रॉम अ ब्लॉक यू मेक अ थिन वायर, इट इज एक्सेसिवली स्ट्रेन, तो आप एनीलिंग करते हो टू रिलीव दी स्ट्रेसेस, ठीक है। सो दैट इज अ डिफरेंट मैटर। नाउ व्हाट अबाउट दी कोरोजन रेजिस्टेंस? व्हाट अबाउट दी कोरोजन रेजिस्टेंस? ये डिक्रीज होगा कि इंक्रीज होगा? कोरोजन रेजिस्टेंस बढ़ जाएगा या घट जाएगा? कोरोसिविटी रॉट मेटल की कास्ट मेटल से ज्यादा होगी या कम होगी? कौन सा वाला ज्यादा स्ट्रेस में है, कौन सा वाला ज्यादा रिलैक्स्ड है? जो ज्यादा रिलैक्स्ड होगा उसका कोरोजन रेजिस्टेंस ज्यादा होगा, जो ज्यादा स्ट्रेन्ड होगा उसका कोरोजन रेजिस्टेंस कम होगा, राइट। तो इसकी जो रॉट मेटल है, ठीक है ना, अगर हम नीचे इसकी प्रॉपर्टीज की टेबल बनाएं तो ये कास्ट, इधर रॉट, स्ट्रेंथ, स्ट्रेंथ तो क्या हुआ? कास्ट की कम है, रॉट की ज्यादा है। डक्टिलिटी, डक्टिलिटी कास्ट की ज्यादा है, रॉट की कम है। ब्रिटलनेस कास्ट की कम है, रॉट की ज्यादा है। और कोरोजन रेजिस्टेंस कास्ट का ज्यादा है, रॉट का कम है। क्या ये बात समझ में आ रही है? क्योंकि इन दोनों में ज्यादा स्ट्रेन्ड कौन है? हाई स्ट्रेन, स्ट्रेन ज्यादा है, यहाँ पर टेंशन ज्यादा है बहुत, ठीक है कि नहीं। स्ट्रेन ज्यादा है। इज इट क्लियर भावना? भावना, आई होप दिस इज क्लियर। और कुछ पूछना है आपको? हाउ डू यू वांट मी टू रिलेटेड विद सीपीडी क्लास? सीपीडी क्लास पे तो दो तरीके के होते हैं, रिटेंटिव और रेजिस्टिव। मेरे ख्याल से ऐसे दो कंपोनेंट होते हैं, एक रिटेंशन क्लास होता है और एक गाइडिंग क्लास होता है या रेजिस्टेंस क्लास होता है, कुछ तो होता है। तो वाले सर ज्यादा अच्छे से कर पाएंगे मेरे ख्याल। वन हैज टू बी रिजिड, वन हैज टू बी फ्लेक्सिबल, इजंट इट। जो रिटेंशन वाला होता है दैट हैज टू बी फ्लेक्सिबल, इट हैज टू फ्लेक्स above the द मैक्सिमम कॉन्वेक्सिटी ऑफ द टूथ एंड गो इनटू द अंडरकट एरिया, ऐसा कुछ होता है रेसिप्रोकल क्लास, और रेसिप्रोकल क्लास नीड्स टू बी रिजिड, राइट, रेसिप्रोकल क्लास नीड्स टू बी रिजिड। अब वहां पर कई बार क्या होता है कि आप रॉट यूज करते हो। द थिंग दैट यू नीड टू अंडरस्टैंड भावना इज दैट यू नेवर यूज अ रॉट अलॉय इन द फॉर्म दैट इट इज फर्स्ट फॉर्म। समझ गई? जब ये फर्स्ट फॉर्म हुआ है रॉट अलॉय, then it is very brittle, it does not have any ductility, but then as I just told you it needs to be annealed, right? anneal करने के बाद it becomes ductile once again। आपने ऑर्थोडोंटिक वायर यूज किया है कॉलेज में, किया है कि नहीं? तो it is very ductile, होता है कि नहीं? तो why is it ductile if the rot alloy is brittle? Because it is annealed, and once it is annealed it again becomes ductile, right? तो जब सीवियर अंडरकट एरिया होता है या और भी कुछ कंडीशंस हैं वो प्रोस्थो में आपको बताएंगे, तो उस केस में आप रॉट रिटेंटिव आर्म यूज करते हो, ठीक है? पर उसके लिए आपको एक बार प्रोस्थो फैकल्टी जो है उनसे कंसल्ट करना पड़ेगा, क्योंकि मुझे प्रोस्थो का बहुत ज्यादा आइडिया नहीं है ना? बट कंसेप्ट जो है वो थोड़ा बहुत इस तरीके से कि ज्यादा है, तो क्योंकि कास्ट आप बनाओगे, कास्ट वुड बी मेड इन थिक सेक्शंस एंड रॉट अलॉय वुड बी अवेलेबल इन वेरी थिन सेक्शंस। तो थिन सेक्शन में होने की वजह से वो ज्यादा फ्लेक्स कर सकता है। क्लियर है? ठीक है, तो फिर कल मिलते हैं वापस डेंटल एनाटॉमी के कुछ क्वेश्चंस के साथ, राइट? गुड नाइट।